were able to be done, and people were immediately able to be transferred to that tent for triage. Well, the fact of the matter is that's what we're trying to do, and though it may not be as visceral as what we saw in Boston, it is just as devastating to a family when someone gets into addictions. And as Carl was saying, the shame, the stigma that comes with drug abuse, with any addiction abuse, sometimes the individual themselves, 9 times out of 10, is never going to seek help because they don't think they have a problem. They think they've got a handle on it. The family, though, the loved ones, the friends, they're the ones that sometimes will turn to somebody. And they usually will turn to members of the clergy, to members of their faith community, because there is that idea of not necessarily the dome of silence as we remember from past experiences, but at least confidentiality. And so we, many times in the clergy, lay leaders, leaders in the church, are being asked, what can I do? What can I do? I think my son's on drugs. I think my husband's on drugs. I think, what can we offer? And the sad truth is, though we may have a lot of skills, actual knowledge of addictions is not exactly, class 101 addiction in clergy seminaries or anywhere else, or even the walk of life. So being able to get educated was one of the big things that we saw here. Being able to understand the problem, but even bigger than that, we created out of this collaboration the Interchurch Outreach Network. And the idea is not to become full-blown drug counselors, but to become aware and create a safety net, a network of resources, being able to understand who's out there so that we can do the immediate responding, but then get those people to the triage they need, get them to the places where they're going to be able to get the assistance, being able to even learn how to speak to them. And I know Pastor Steve's going to be able to explain more about some of the training that he underwent in this program, as well as Carl and others, and so that we could learn how even to talk to someone who has an addiction, so that they don't feel condemned, don't feel like they're being judged. Because too many of us, we come from do you understand what you're doing to your family routine? Which is very common for us, because number one, between our fear, between our anger, between our frustration, we're like, don't you understand? Well, the truth is, when someone is in addiction, they don't understand. No. But that's what the clergy needed to learn. That's what we needed to train people in, so that now we can become effective. It's about becoming effective and being able to bring that together. We all come from our faith perspective, and I do believe the faith community, dealing with our mission of hope, mission of faith, there is a great place where we can bring healing.
Absolutely.
But not everybody is even ready for that. And so now building this collaboration between churches that offer services or Christian organizations that offer addiction services, it's also recognizing the great places in this area, like St. Luke's and South Coast Hospitals, and some of the different organizations that do this work, do it every day, like Packer and Seven Hills and others. We need to be able to understand who's out there, how we get them to it, because the fact of the matter is, our goal is to help that person in need. And that means whatever avenue we have to take, that's the avenue we have to travel.
Absolutely. So there is a sensible process that you are following, beginning with intake, referral, and having knowledge of what the individual is going through, because the last thing that you want to do to someone dealing with addiction is to drive them away, to push them out there. You want to make sure they're able to take advantage of the services that are available to them. With that, I'd like to pass to Steve to get you to jump into this conversation. What is your role in terms of what is the training that you went through, and what is the part that you're playing in this collaborative?
One of the grants that the city was successful in securing paid for a team of us to go to Boston University where we were exposed and were introduced to Dr. Bernstein, who introduced us to the brief negotiated interview process. And it's a methodology where you learn how to converse with someone, so that at the conclusion of the conversation, they're going to write their own personal script for change. Carl and I and others attended this training, and I had an opportunity to go back for a second so that I could be trained as a trainer. And the methodology can be used in any discipline, whether it be substance abuse or overeating or whatever the situation may require. But we have found that, as Pastor Lima said, many of us in the clergy are the first that are addressed.
Because
Parent will
of the
call us
confidentiality.
because of confidentiality, because of the comfort, because of a sense of trust that you are not going to necessarily judge me.
Exactly. That's
But
important.
we're just 2 weeks removed from our most recent training called START, which is an acronym which stands for Substance Abuse Treatment and Referral Training.
Okay.
And we heard from the folks who attended, more than 30 folks attended, 4 Tuesday evening, 5 to 8 p.m. sessions. And we heard from them admitting that their postures and their procedures and their approach to these conversations were not necessarily effective. And so as people who are looking to increase our effectiveness and our efficacy of our work, we wanted to make sure that we put practical, tangible tools into their hands that could be used on a daily basis. And we achieved a lot of success. We had, we emphasized the fact that we're not going to release you to become clinicians, but we're going to release you to be able to converse with someone without alienating them and turning them or encouraging them to continue the guise of denial. A lot of folks with substance abuse will not articulate those words that I need help. But if you learned the methodology and how to approach the conversation with the goal in mind that I want to hear from them, that they themselves are their best expert about their lives, then it's a disarming kind of methodology where you begin to disarm them of all of the defense mechanisms that exist normally and naturally, and then you begin to open up and talk to them like a real person. Part of our training at Boston University required that we put this into practical use, and they took us across the street to the Boston Medical Center. We were all assigned someone to observe us and to assist us. But for whatever reason, the person who was to observe me had to leave because of another emergency. So I had never done this before. I was introduced to an Irish woman who had a very large bruise on her face, and it was my responsibility to utilize the methodology to get her to talk to me. And I was a total stranger to her. She didn't know me from Adam.
And how successful was that?
It was phenomenal. I was able to introduce who I really was as a pastor being trained in the methodology, and she asked me to pray with her.
So give me an example. Let me stop you right there. What was your first question? I would imagine you just didn't come out and say, how did you get that bruise on your face? How did you ease into getting that information out?
We start with an introduction. Hello, my name is Reverend Steve Rodriguez. I'm a part of the team here at Boston Medical. I'm in training, and would it be okay if I ask you a few questions about why you're here today? I'm not here to set judgment. I'm here to ascertain the best way that we can provide you services that you need. Would that be okay? And she responded and said yes. And I said, so tell me, what is it about your substance abuse that you like? That question completely disarmed her, because most people come from the standpoint,
why
as
are you
Reverend
doing
Lima, why are
this?
you doing
How
this?
did this happen?
What's the matter with you? That posture is not adopted in this methodology. We try to communicate and emulate sincerity, compassion, concern. And so when I did ask the question about the bruise, she said, I'd really not like to talk about that. And that was fine. And so I went into the methodology, and we had a cheat sheet. There's an actual card that maybe Carl can put into your hands that gave us what we should be looking to accomplish. And there are specific points that we follow.
And in the
card.
interest of time, I'm going to jump in, and I would think that part of the methodology is to get them a level of comfort
Yes.
so that they start to open
Yes.
up and the information.